Indeed, so we're talking human health this morning, and the topic of the day, bladder infections. Now, while they're much less common in men, more than half of all women get at least one bladder infection at some time during their lives. So with us to discuss how to diagnose and treat them, multimedia health specialist and SAFTA nominee, Dr. Darren Green. And the doctor will also be taking your calls after the discussion. So give us a call on 083 91 33728. Good to have you, sir. How are you?
Fantastic.
Very well. It's been a while. It's been a while.
Indeed.
So let's talk about bladder infections. Exactly what are they from a medical point of view, and what causes them?
Yeah, often mistook for UTIs or urinary tract infections. So important to differentiate. The bladder itself is referring to only the bladder, which is like a ship basically, and that's where the urine collects after filtering and draining from the kidneys. So one-way flow from the kidneys down the ureters into the bladder. And when we speak of a bladder infection, we mean a colonization, a takeover of bacteria and infective organisms inside the bladder that then irritate the bladder lining and lead to the problems or complications.
Yeah, and so what then are the symptoms, and how do you diagnose it?
The first one is frequency. In other words, you feel that you want to go to the toilet more often.
Okay.
By the time it hits the burning stage, which is the dysuria, it's often a little bit late in the progression of the disease. But often a low-grade fever, sometimes even a little bit of lower back pain at the back, associated also with some tremulousness or even a bit of shivering. Nausea and vomiting, interestingly enough, form part of the infection of the urinary tract.
Yes. And when it comes to the treatment then, how then do you address that?
I think the first thing is prevention. So if you're prone to get a lot of bladder infections and recurrently, you need to look at preventing by drinking lots and lots of fluids, water particularly.
I was about to say, so water being the primary one that you want to get in.
Yes, and your pH, your acid level in the body, either facilitates or minimizes your chances of bacteria colonizing. So your pH of the blood is also important in terms of controlling the environment that bacteria grow in. And then, of course, looking at anatomical structures, the draining of the bladder, your toilet habits. Are you hygienic? Are you not? What kind of underwear do you wear, etc. Along with that, obviously, the direction of wiping for female, front to back versus back to front when you go to the loo. And then just anatomically, sometimes the urine is not supposed to go back up the kidney tubes or the ureters. The valves that prevent that are often worn out or don't function properly. So you have a reflux of the urine, which adds to that problem. And then in children, obviously, they don't want to go to the toilet in winter, so they keep it in for long periods of time.
Wow. So you need to advise against that.
That's that. And in the classroom as well, they're too scared to put up their hands and say, "Ma'am, can I go to the toilet, please?"
Right. Okay, and when it comes to the long-term outlook, and, after how long should you start getting worried that it hasn't cleared up now and there's something of great concern?
So I think initially when people struggle with a bit of discomfort, they might want to consider just increasing their water intake, for example, or even alkalizing the urine, where they take something like Citrusode or Alka-Fizz to change the pH. That often is good enough if done early, but if it isn't, then you obviously need to look at seeing your doctor for the complications where that bladder infection can spread up and even cause damage to the kidneys.
Indeed. Well, thank you very much for that, Doctor. That was our brief kind of first discussion about it, but the calls are now, or the lines are now open, 083 91 33728. And if you have any questions regarding this topic, please call us and we'll be taking your calls right after this break.